The standard technique for removal of a suspicious lesion is the elliptical excision. The traditional method is to leave a margin of normal tissue around the lesion. Then, the length of the excision is 2 1/2 times the width. The lesion is excised full thickness down to subcutaneous fat. A suture is placed at one end for orientation. The wound margins are undermined with blunt and sharp dissection. The wound edges are then brought together with an absorbable suture beneath the skin. This allows us to close the wound with a minimal amount of very fine nylon sutures, which can now be removed at 3 days without disrupting the wound. This technique is fine for small lesions. However, with larger lesions, the tension required to close these wounds results in wide, depressed scars. Bringing a graft of tissue from one area to another creates a mismatch in color, texture, as well as thickness. Filling a large defect with tissue similar in thickness, color, and texture is the ideal objective. One such technique is the amazing Limberg Flap. The rhomboid transposition flap was developed by Alexander Limberg of Leningrad. This amazing flap has a simple mathematical formula in which all sides are designed to be equal. Large wounds can be closed with minimal tension and usually superior scars. This lesion presents a challenge due to its size and location. The challenge is to design a flap which will not disturb the hairline and which will blend into the crow's feet as best possible. To achieve this, the flap is oriented so that when finished, the tail of the scar will lie in one of the crow's feet wrinkles rather than across them. The lesion is excised with a small margin of normal tissue around it, and a suture is placed at the 12 o'clock position. This enables the pathologist to orient the specimen. The information we need is, what is the lesion, and did we get it all out? The pathologist can now pinpoint the location of any residual lesion and recommend further removal in an exact location. Electrocautery is being used to remove the specimen with minimum bleeding. The cautery seals the blood vessels as it cuts the tissue. Now, there is a nice dry wound ready for closure. It could be pulled together and sutured under tension, leaving a wide, depressed scar and possibly distorting the eyebrow. It could be covered with a skin graft, leaving a mismatch in color, texture, and thickness. Or it can be closed with a Limberg flap, which will heal rapidly with no tension or distortion of the surrounding structures. It will have the same color, the same texture, and the same thickness as the surrounding tissue. A parallelogram flap is designed, and this is transposed into the defect. The donor site is obliterated as the flap moves over into its new location. The first suture is used to obliterate the donor site. That is, the location where the flap was taken. The flap now fills in the defect created by removal of the lesion. After the edges are meticulously sutured, the entire area is closed with a perfect match of color, texture, and thickness. The tail of the scar will lie in the crow's feet, and the hairline is not distorted. Master Sol glue is applied to secure a neat, simple dressing of steri-strips which will withstand sweating and showers for 5 days when the sutures are removed. Compared to the conventional techniques of elliptical excision or skin grafting, the amazing Limberg Flap is certainly a better way.